Hello, young man. How are you today?
Who are you?
I'm President Barack Obama. And I'd like to explain to you why you should be happy about my new comprehensive healthcare reform package.
Okay, shoot.
Don't say shoot. It makes my Secret Service detail kind of twitchy.
Okay, let's hear what you have to say.
My new comprehensive healthcare reform package is called the Affordable Care Act. The Affordable Care Act is expanding your options for health insurance and making them more affordable.
If the law makes health insurance more affordable, why don't you call it the Affordable Insurance Act instead of the Affordable Care Act?
Never mind that. Listen, if you're age 18 to 25, you may not be thinking about health insurance. You may think you're healthy and don't have to worry about it. But what if you get into an accident or have a serious illness? Your medical bills could put you in debt or ruin your credit.
I'm already in debt from student loans and my credit is shot from maxing out on free credit cards. What I could really use is a job. Are you working on that?
Not really. But I want to talk to you about health insurance and the Affordable Care Act.
Okay, so how does this Affordable Care Act help me?
Well, starting as early as September 2010, if you're under age 26 you can be insured as a dependent on your parents' health insurance.
I'm 24 years old. I don't want to be dependent on my parents for anything.
Well, you can be a dependent for purposes of health insurance coverage, even if you are not financially dependent on them.
So you're going to just say I'm a dependent so I can get health insurance, even when I'm not really a dependent?
Yes.
That used to be called insurance fraud.
Yes, but now it's okay. Anyway, another important thing is that starting as early as September 2010, new health plans must cover preventive services without cost sharing.
What does without cost sharing mean?
Well, under your old plan, if you went to get a physical you would have to pay a $20 copayment. Under the Affordable Care Act, when you get a physical you do not have to pay the $20 copayment.
Who pays it then?
Who pays what?
If I don't pay the $20, who pays it?
Someone else.
Who?
I don't know. Look, the $20 is built into the premium.
So I really do pay it after all.
Yes, but not directly. And only part of it. The cost of the copayments is spread out among all the people that buy health insurance.
So instead of paying $20, I pay 2 cents. And say 1,000 other people pay 2 cents.
Yes, pretty much.
What if everyone gets the physical?
Then you will each end up paying $20 more in premiums.
And the health insurance company takes 20% of that $20 for administrative expenses?
Maybe.
But the doctor will still get his $20.
Yes.
So all I want is a physical and you are involving 1,000 more people in the payment process and you have to collect $24 instead of $20 to make it all come out even. Is that what you mean by making care more affordable?
You're not understanding correctly. The Affordable Care Act helps you get better access to care.
So far it's sounding like a ripoff.
Well, let me ask you this. Are you employed?
No.
Okay, see? Starting in 2014, if you're unemployed with limited income up to about $15,000 per year for a single person, you may be eligible for health coverage through Medicaid.
Governors across the country are slashing Medicaid budgets to try to close a $140 billion budget gap for 2012. Medicaid is headed for a cliff.
That's true.
Wouldn't it be better for me to be employed? That way I can get my health insurance through my employer?
Of course that would be preferable.
Isn't your Affordable Care Act leading many employers to drop their health insurance offerings?
Not exactly. We've given waivers to many of those employers, so they will keep offering health insurance coverage.
But the waivers only last for a year.
Yes. Or 2.
What happens when the waivers expire?
The employers will drop the coverage. But that's okay, there is more good news.
Oh, I can't wait.
Because starting in 2014, if your employer doesn't offer insurance, you will be able to buy insurance directly in a health insurance exchange. The new exchanges will offer you a choice of health plans that meet certain benefits and cost standards.
You said it was preferable for me to get insurance through my employer? What does the Affordable Care Act do to make it easier for my employer to offer me health insurance?
Nothing. And for small employers, the Affordable Care Act actually makes it harder. But as I said, the new exchanges will offer you a choice of health plans that meet certain benefits and cost standards. Maybe you could be happier about that.
If I don't have an employer that will offer coverage or even have a job to pay the premiums on my own, what good will the exchange be for me?
There's always Medicaid.
This is really great. Anything else I should know about this Affordable Care Act?
Yes. Starting in 2014, if your income is less than the equivalent of about $43,000 for a single individual and your job doesn't offer affordable coverage, you may get tax credits to help pay for insurance.
I'm almost afraid to ask. Who is paying for these tax credits?
You.
I knew it.
The massive deficits my administration is incurring now will be paid for by you and your college buddies later on in life when you finally get jobs and start paying taxes. Because our economy is so bad and the Tea Partiers are so angry, we can't raise taxes right now to offset the deficits. So they are being paid for with debt. My current budget plans actually increase the debt from $7.5 trillion at the end of 2009 to $20.3 trillion at the end of 2020. By then, about 3% of all the economic activity in the nation will go just to pay interest on the debt.
You are going to triple the national debt in just 10 years? That's about the time I'll be having kids of my own.
Yes. And remember that under the Affordable Care Act, your children can stay on your health insurance plan in most cases until they are 26 years of age. And you will be able to thank Barack Obama and the Democrats for that particular privilege.
I'm not sure that's what I'll say.
I'm glad you finally see what my comprehensive health care reform package will accomplish for you. I hope you'll tell all your friends what we've talked about.
You can bet I will.
Thanks for your time. I'm glad we had this chat.